Hello. Scoliosis. I'm sure all of you can remember back in the day where you would go to the school nurse and with your t-shirt on, you would bend over and the school nurse would check your back for symmetry as you stood up. That was your scoliosis check. Well, things have changed a bit. Things are a little bit more technical now than they used to be. One of the routine things that we do for our patients here in the office, because we do have a large family practice with lots and lots of children, is when they get to a certain age, around 10 or 12, before puberty kicks in, we like to do our first set of x-rays and full evaluations for that patient, even for asymptomatic patients if there is any indication that there may be a scoliosis. There are two different types of scoliosis. There is a structural and a functional type. A structural scoliosis, well, first let me explain that a scoliosis is defined by any lateral or side-to-side movement of the spine. The spine should be perfectly straight. But if it's not, then technically that would be considered a scoliosis. Well, under that, there are two main types. There's a structural and a functional. A structural scoliosis is some type of deformity from birth. Any type of abnormality, a congenital abnormality from birth in the bone structure, not allowing the bones to stack on top of themselves appropriately, thereby causing the lateral movement from side to side. That's what we typically think of when we think of a scoliosis. That is that structural deformity that causes like that hump in the back and maybe some rotation in the rib cage. And that's typically what the nurse was checking for in children. We can see that on an x-ray a lot more definitively, and we can help that patient, guide them in the right direction, the earlier the better, to help minimize and reduce the progression of that scoliosis, especially through puberty. As soon as puberty hits and that huge growth happens, that's when a very mild scoliosis can become something a bit out of control. So we want to be able to be a part of that sooner the better. A functional scoliosis, however, is much more common. That is when the bones aren't everything looks fine, everything is structurally sound. However, the bones aren't properly aligned, thereby causing or mimicking the characteristics of a structural scoliosis. That, on the other hand, is correctable. We're able to reduce or correct that lateral movement, and over time, with pre and post x-rays, we're able to see the actual change in the structure of the spine. It's really not that much different than a dentist or a orthodontist who puts braces on your teeth and takes before pictures and your teeth are crooked, puts braces on, moves the structure of the bones in your mouth, your teeth, and then takes a post x-ray, a post picture, and shows you a before and an after picture of what your teeth used to look like and what they look like now. So that's sort of in a nutshell what we do here as corrective care chiropractors for people who have scoliosis. Hope it helps.